Hi,
Hi,
Bharti.
how are you?
Yeah, I'm good. How are you?
Good, good. It's been a long time.
Yeah, it's been a very long time.
Yeah, more than
So,
two
how's
years.
New York?
New York is good. Yeah, it's a lot of adjustment, but yeah, it's going well.
Okay, okay. Yeah, understood. So, you miss India?
I do actually. I'm planning to visit in December.
Yeah,
Yeah,
yeah, sure. Please do come.
yeah, yeah, yeah. So do you work
Okay,
with
so
the
yeah,
system?
yeah,
Okay, you guys are doing a lot of good work. Yeah.
yeah. Thank you so much. So, basically, we are the place wellness platform where we provide the maximum amount of PCOS management because we do know it's not a curable condition. So we need to make them aware that it is manageable through all the lifestyle changes that we can do. So that is what our motto is about. So yeah, that's it.
Yeah.
So I think we can go ahead with the live. So,
Sure.
hi guys. So, here we are with Nutritionist Bharathi. She finished her UG in Chennai and she finished her PG in, I think, in Melbourne, right?
No, no, in the US.
In the US. Yeah, yeah. She finished her MS Human Nutrition. So, she is here telling you so what to do and what not to do with the PCOS and how you have to practice the foods with the PCOS condition. So, let's go. Okay.
Mhm. Yeah.
So, hi, Bharati. Once again, hi. So, let's start with what is PCOS and what is the basic symptoms that we should concerned about with the PCOS.
Okay, sure. So PCOS stands for Polycystic Ovarian Syndrome. Now, as you might already know, it was called PCOD, Polycystic Ovarian Disease
Mm-hmm.
before. Now, the reason why it was changed is disease is something that has a definitive cause, like you know what is causing it, and it has a definitive treatment, like you know how to treat it, how exactly to treat it. But a syndrome, on the other hand, is like a bunch of symptoms thrown together and you don't know the exact cause and you also don't know exactly how to treat it, which is why it was
Mm-hmm.
more appropriate for us to rename PCOD to PCOS. Now,
Yes.
before we start, I just wanted to give you a brief information about what ovaries do. Again,
Mm-hmm.
you may be aware of all this
Yeah,
information. I
yeah,
just want
yeah,
to
sure,
start with the basics for the audience. So, the
sure.
ovaries are the primary sexual organs of females, and like it is testicles for male, and this is responsible for releasing eggs that can be fertilized by sperms, and which leads to conception of a baby. Now, ovaries have something called follicles, which contain these egg cells, and they release these egg cells during ovulation. Now, what happens in PCOS is these follicles do not mature. The egg cells are, contained within them and not released, and these follicles, these immature follicles, start accumulating on the ovaries. Which is why, when you look in ultrasound, ovaries that have PCO, like polycystic ovaries, can be enlarged, and they have more of these immature follicles on them. And this can lead to an imbalance of hormones, mainly reproductive hormones like female hormones like estrogen and progesterone, and can also lead to an imbalance in male hormones. Now, male hormones doesn't mean only males have those hormones. We also have it to some extent, but
Yes.
there is an imbalance where these androgens are increased. So mainly testosterone is increased. So this can lead to abnormal menstrual cycle, or in some cases, you might not even get your period. And it also leads to unpredictable ovulation, which is why women with PCOS can struggle with getting pregnant. Now, this is an
Yeah.
overview of what PCOS is. And to answer your second question, what the symptoms are. Now, there are three main symptoms. One is irregular or absent periods, which we discussed. And the second one is hyperandrogenism, which basically means you have elevated testosterone levels in your body. Now, this manifests in two forms. One is in your blood. You can, find that your blood levels of testosterone is elevated, or you can have symptoms that are visible on the outside.
Mm-hmm.
Like you can have acne, you can have hair loss, and especially male pattern balding, and you can have a bunch of other symptoms. So it's visible to the eye, and then you can also check your blood
Mm-hmm.
levels. And then the third symptom is actually having these, immature follicles on your ovaries.
Okay.
Now, there
Mm-hmm.
are at least like three main organizations that, determine the diagnosis, treatment of PCOS, like the Endocrine Society, the Rotterdam criteria.
Mm-hmm.
So all of
Yeah.
these organizations agree that if you have two out of these three symptoms, you can be diagnosed with PCOS. So it's interesting,
Okay.
and it should be noted that you may not even have follicles on your
Mm-hmm.
ovaries and you could
Yeah.
still have PCOS. Mhm.
PCOS. Yeah, that's interesting because many of them have the other two symptoms like without
Mhm.
this is, but still they do have, trouble getting their periods on time. So all those things. So they can be also diagnosed with the PCOS.
Mhm.
And also other than PCOS, there's a lot of other criteria. Like predominantly when you don't get a periods and all, they have this idea might be I might have hypothyroidism or hypothyroidism. So that is also the misconception, and that that made PCOS into put into the dark zone. So I
Mhm.
think despite of having, concentrating on thyroid, you also have to focus on the PCOS.
Yeah.
So
Yeah.
yeah.
Yeah, I think it's eliminate to
Hmm.
important to eliminate all the other causes so you can
Hmm.
determine if it's actually PCOS, and
Yeah.
all this can be done by a doctor. So that's how you diagnose
Yeah.
PCOS. You go to a
Yes.
doctor and then they do a blood test. You measure your thyroid hormone levels, and then you also measure your
Hmm.
testosterone levels. So if you can
Yeah.
eliminate thyroid, the next thing that you can look at is your testosterone levels.
Yes. Yeah.
Mhm.
Yeah. That's very wise way to proceed with that, and that's why we need a professional guidance with that. So let's move on to the next question. So usually, what will be the major cause, and how to properly diagnose that you have a PCOS? That is what we talked about. But what might be other reasons, like despite of having hyperandrogenism, is there any other causes behind it?
So we don't know the exact cause, which is why it's called a syndrome. And
Hmm.
there are, certain predictors. One is a genetic component. For example, if your mother or your grandmother or let's say your aunt, if any of these people have PCOS, there is a likelihood that you might also develop PCOS. Now, the reason
Hmm.
is there are, for any characteristic you have, there are genes that are passed on from your ancestors, from your mothers, your grandmothers, sorry, parents, your grandparents. And so when you inherit these genes, there could be some defect on some genes and they might lie dormant. They might not be
Hmm.
activated. Now, these could be activated by certain environmental factors. If you have unhealthy lifestyles, and there are also other, hypotheses. Now, these are not definitive causes. I just want to emphasize that.
Okay.
Now, there are
Yeah.
other, predictors having low birth weight or being obese in childhood, having rapid weight gain in infancy. So, all of these also play some role, and these could activate the defective genes that can lead to, the hormonal imbalance and malfunction of your ovaries.
Mhm. Okay, okay. That's the one point. Yeah. And also, like, is it a very serious condition that we have to address it immediately? Because whenever a patient comes with us, asking for PCS guidance, is that point where they want to get pregnant. So, is it a PCS is a condition where you should address earlier, or is it okay to address it in later conditions?
Mhm. So the first thing is if people get it diagnosed, early on, I think it's great because you can work on
Hmm.
lifestyle changes. And one thing we need
Hmm.
to acknowledge is there is just a lot of pressure on women to get pregnant,
Yeah.
especially as they get closer to their 30s. If
Yeah.
they haven't been able to conceive yet, there is just way too much pressure. So when they come
Hmm.
to
Yeah.
us at that time to want to tackle PCOS, honestly, they're not in the mindset to
Yeah.
focus on long-term lifestyle changes. So that's why I think it's important to get tested like way ahead
Hmm.
of time. When you're in your 20s, early 20s, get it diagnosed and then start working on it. So you don't do that last
Yeah.
minute, you know, um,
Yes.
solution for that.
Yeah, that's exactly our motto because September month is actually the PCOS awareness month. So we've been trying and spreading as much as awareness that you should listen to your concerns of your body, you should listen to your signs and symptoms, so that you can maintain a better lifestyle changes. So
Mm-hmm.
that is what our intentions of this September PCOS awareness month is to. So
Yeah.
yeah, let's move on to the diet part of the PCOS.
Mhm.
So like there are a lot of controversies like where we can avoid or restrict on dairy and gluten as such when it comes to PCOS diet. So is it really working? Like
Mhm.
restricting dairy and gluten is really working with PCOS?
So I think there is just a lot of fear mongering. People want to blame
Hmm.
something for the symptoms that they have, and
Yeah,
unfortunately, dairy and gluten have gotten the
yeah,
bad reputation these
yeah,
days. So mainly because I think there is an association between dairy and acne, and that's why people with PCOS immediately assume that eliminating dairy can improve their symptoms. But we need to
Okay.
note here that if you have lactose intolerance, then there is some evidence that you could develop acne. So the first thing you need to do is check if you're lactose intolerant and if you're intolerant when it comes to gluten. So
Yeah.
gluten is a protein that's found in wheat products, and then lactose is a sugar that's found in milk. And these two are usually very common intolerances that people might have. So the first step is to do an elimination diet. Now you can eliminate both dairy and wheat together, or I recommend doing it one after the other. So first people should eliminate dairy for 2 weeks or even 3 weeks, and then slowly start incorporating it back into their diet. And if they get any of these symptoms like bloating or flatulence, which is like feeling gassy, and if they get acne, and all of these point towards lactose intolerance. And with gluten, you might feel the same symptoms, bloating, and then there could be diarrhea. So eliminate the food for at least 2 to 3 weeks, reintroduce it, and see if any of the symptoms come back. And only if you have intolerance, I would recommend cutting out these products. If you're not intolerant, it really doesn't make sense. Because think about it, like a lot of Indian foods have dairy, and we eat a lot of
Yeah.
curd, and we drink a lot of milk, paneer.
We do.
So if you eliminate dairy, can you really imagine sustaining it for
No,
lifelong? I don't think
really
so.
can't.
And also wheat, right? We love our rotis, our bread.
Yeah.
So yeah, we. I don't think it's sustainable for Indians. And imagine you're following such a restrictive diet for like years, and you find out that it's not even helping. So
Yeah.
why do that in the first place?
Yeah.
Yeah. So the
That
approach that
that
you
gives
need
you a
to.
big hurt.
Yeah, the approach that you need to take is first eliminate intolerance as the cause for your acne or bloating or whatever symptoms you might feel, and then you can proceed with other
Yeah.
dietary approaches.
Yeah, that's fair. Yeah, that's fair. So actually, the next question is like, do we have to, follow the particular diet pertaining to the particular symptoms? Like, for example, if I have a irregular periods with the PCOS, so do you have to, follow one particular diet so that I can combat that particular symptom? Is that
Mhm.
possible?
So I think that's a very interesting question, which your follow-up question is if we can have supplements. So I think there is an overlap here.
Yeah.
So when it comes to food, there is no specific or special diet that can, immediately resolve PCOS. Like you said, we can only manage PCOS through diet. So having a well-balanced diet is the first step. Now, if we look at the
Yeah.
symptoms, let's just give a brief overview of what the, complications of PCOS are. Like you said,
Yeah. Yeah.
why
Sure.
is it important to address PCOS? Now, approximately 1 in 10 women in India have PCOS. So that's like 10% of the female population, which is a significant number, right? So, which is why it's very important to address PCOS. And there are several complications. You could develop insulin resistance, which could eventually proceed to pre-diabetes, diabetes, and then there could be elevated blood pressure, and you can also have, infertility. And then there is a chance that there could be miscarriage or premature birth. So all of these are there. And the other thing is it could lead to, fat accumulation in the midsection, like around your abdomen area. And, when you have all these conditions going on, it tends to take a toll on your mental health. So you might also have depression, anxiety, and then it can all lead to poor body image, which basically means the way you perceive your body is changed. It's a negative way of looking at your body. You're not satisfied with how it looks. So all of this can in turn feed depression and anxiety. So what people tend to do is they just want to, they're pushed to a point where they just want to resolve these issues, which makes them follow some crash diets or some fad diets that
Yeah.
really don't work. So this is where diet part comes in. There really is no special diet that can magically cure all of these symptoms. It's a
Yeah. Sure.
combination of what you eat. Are you eating enough protein in your diet? Are you eating, good fats in your diet? Are you eating enough fiber? So all of these things play an important role because when you look at diet, you said, can we address particular symptoms, right? So there is insulin resistance and then pre-diabetes, diabetes. Now, you can take any dietary approach. I don't suggest like specific diets for people, but I'm also not against any diet they intend to follow. Like, for example, if you check out my page, I talk about keto diet, but I
Yeah.
specifically talk about, the scientific perspective, how you can do it the right
Mm-hmm.
way. and then whether, I talk about the pros and cons and whether you need to do it in the first place. So any
Yeah.
diet that comes to your mind, if you would want to follow it, I'm not going to hold you back, but you need to check if it's sustainable and if it's going to be the right fit for your PCOS. So I would definitely recommend first checking whether a diet is sustainable and check if your macronutrients are in the right ratio. For example, keto diet is an extremely restrictive form that restricts
Yeah.
carbohydrates to 5 to 10% of your total daily intake, which is not sustainable. So we can rule
Yeah.
out keto diet if you ask me. But
Yeah.
the keto diet is a form of a low carb diet. Now you don't need to go into an extremely low carb diet. You can follow a moderate version of a low carb diet where it's not very restrictive. So if you look at the carbohydrate intake recommendation of a balanced diet, it's between 45% to 65%. So 65 is the higher end and 45 is the lower end. So you can go to the lower end. You can go to 45% carbs or 50% carbs, and it's considered as a low carb diet. Now you can follow a low carb diet, which can benefit in controlling your blood glucose levels. And then your protein needs to be on point. Your fat sources need to be on point. So whatever diet fits these criteria, I am okay with it if you follow it.
Yeah.
Right?
That's actually
Yeah.
a very wise step because you have to check whether the diet is sustainable and
Mm-hmm.
if that suits your purpose and if that's helps you maintain, yes, then you can go for it. So yes,
Mm-hmm.
that's a very wise advice, I guess. Yeah,
Yeah, and
and the
just
next,
want to also follow that up with
mm,
what kinds of diets people usually intend to follow.
yeah,
Number one is keto diet. Now, I think paleo
hmm,
diet, the hype has died down. I don't know
yeah,
if I'm sure or 100% right about this, but I feel like the
hmm,
hype has died down. But paleo
yeah,
diet basically means you eat what your ancestors or
mm,
early humans ate. You
yeah,
only need to eat something that's hunted and gathered, like meat or nuts and seeds and stuff like that, which is extremely restrictive and people don't follow that
yeah,
anymore. What's the next diet that people usually consider? I think intermittent fasting. It's important to note that
yeah,
IF is not a diet in itself. It's
hmm,
just a way in which you eat. It's an eating pattern. You alter the timing of
mm,
your meals. You eat within a certain window and you fast for the rest of the day. You can eat all your meals within 8 hours and fast for 16 hours. So now this has also shown to have some benefit when it comes to maintaining your blood glucose levels.
mm,
So again, you need to ask yourself if it's sustainable. So you can
yeah.
pick any approach. Yeah.
Yeah. Yeah, that's actually intermittent fasting is the most recurring, diet that clients have been,
People talk about, yeah.
following because they want to lose weight because with PCOS there comes a weight gain and they want to suddenly lose weight and they go for intermittent fasting without any proper guidance. Yes, and they've been just cut down their foods entirely without their essential needs and all. So that's a pretty disaster coming up there.
Mhm.
So yeah, apart from that, there's a lot of supplements growing up in the market, like Ovacitol, Inositol as such. So
Mhm.
how about that? Can we take supplements as such for the PCOS?
Mhm. Now, this is where your previous question also comes in, where you
Mm,
said, is there a particular way in which we target
mm,
certain symptoms? So, when it comes to inositol, it can improve fertility. So, that's
mm,
one thing that I would recommend if a client has infertility or missed periods or irregular periods. So, that can target that. And when it
mm,
comes to also, again, we need to talk about medication. We can't really rule that out.
mm.
So what happens is
Yeah, sure.
another risk or complication that I forgot to mention previously is when you don't get your period for a long time, a very long time, your likelihood of having endometrial cancer is increased. So basically, what is a
Okay.
period? When you have a period, your uterine lining, uterus is basically the organ that carries the baby. So your uterine lining is flushed out from your body. So
Mm-hmm.
that comes out as your period. Now, when you don't get your period for a really long time, the endometrial lining, tends to stay there, and that can lead to endometrial cancer in the long run. So, which is why doctors, their first approach is when they see that you haven't had a period in let's say 6 months or 1 year, their first approach is to give you OCP, oral contraceptive pills. Now, that targets your, infertility or your absence of
Yes.
periods. we can target it through diet by giving a supplement that is inositol, right? And then next is
Okay.
insulin resistance, which is a predominant complication. Now, you can
Mm-hmm.
target it with food. You don't need to necessarily do a low carb diet, but if you want to do that, that helps. But you can also follow your normal dietary pattern, like 65% of carb intake. That's also fine, and you can still manage insulin resistance. Now, from a medication perspective, a doctor might give you metformin. You can choose to take it. What
Yeah.
I tell my clients is you can follow your doctor's advice and also follow my advice on the side. But if they have time, right? If they diagnosed it early on, what I tell them is give lifestyle change a shot. Like give it a shot, and you might not even need medication. So
Mm.
insulin
Yeah.
resistance can be tackled by diet, and there is no one particular ingredient. It's your dietary pattern that can tackle insulin resistance.
Yeah.
Yes, and yeah, those are the two main things. And then infertility, we can also supplement with B9. B9 is
Mm-hmm.
folate, which is very important for fertility. Now, you can get it through food, but if you want to really improve your fertility, a good supplement is going to be helpful.
Yeah. And how does it inositol works? Like, how does it helps to, bring out and normalize your periods?
Mhm. So I'm not exactly sure what the mechanism is. Honestly, it's a little too
Yeah.
complicated for me. But
Okay.
what I
Yeah,
do
sure.
know is if you continue to take it over a period of
Mm-hmm.
time, your period stabilizes. For example, I had a client who
Mm-hmm.
came to me with complete absence of periods, and I encouraged
Okay.
her to take inositol. And within 2 months of working with me, she actually
Mm-hmm.
got her period. And she was very
Mm.
happy about it.
Okay.
She was very emotional about it. So that's why I strongly believe that inositol works if you have missed
Mm-hmm.
periods, and you can give it a shot before you try OCP.
Yeah. Yeah. Correct. So, and yeah, the most hurtful and most big hurdle is that following the diet itself. Staying in that consistency and staying and motivated is a very big thing. So, is there any tips or suggestions that you'd give to, stay motivated to follow
Mhm.
the diet?
Yeah. So I would approach this question in two parts. So the first one is clients who come to me, there are two categories. Ones who want to prevent any diseases, they are the preventative
Mm-hmm.
category. And then there are clients who want to manage a condition, who already have a diagnosis and they want to manage it. Now, when you look at
Mm-hmm.
motivation, I feel like, the preventative category, they are motivated, but the ones who have a health condition are more motivated because they want to
Mm.
see the improvement in their
Yeah.
health condition. So in general, I'm assuming that people who have a PCOS diagnosis should get that intrinsic motivation to take care of their
Mm-hmm.
health. So that's one thing. And the second thing, if we look at it, is you don't. People think you need motivation to actually go do some things and get results. It in fact works the other way around. You can push yourself to
Mm-hmm.
go do that exercise or make that lifestyle change, and then when that shows result, that's when you're more motivated to follow.
Yeah.
So I think you need to
That's
give
nice.
lifestyle change a shot, stick with it for a
Mm-hmm.
period of time, at least a few weeks, and when you start seeing the result, that will get you motivated. This is why
Yeah,
people,
that's nice.
go to the gym for 2 or 3 days and then they're not
Yeah.
motivated to go anymore.
Yes.
I'm saying you go for a month. When you see the changes, that's when you will immediately wake up.
You
Like
get,
I know
yeah.
people who try to wake up at 5 a.m., 5:30 a.m. to get their workout done because they're busy rest of the day.
Mm.
Now you can't do
Yeah.
that from day one. Like you can't just say, okay, from tomorrow I'm going to wake up at 5 and go to the gym. No, push
Mm.
yourself. Go at whatever time you can, and when you see the benefits, a busy day is coming up. You'll tend to prioritize your workout, right? You will say,
Mm-hmm.
okay, let me wake up and do my workout
Mm.
before I start my day. So that's the
Yeah.
place people need to reach.
Mm. Yes. Yeah, that's actually a very good one because whenever we see the results, that's how we get more motivated
Mhm,
than before. Yeah, that's a very
mhm.
good point too. So how come, when in PCOS, how come the lifestyle changes have the impact? Like, be it physical activity, be it diet, how come these two have the huge impact rather than medications?
Mhm. So mainly when we talk about diet and physical changes. We talked about infertility. We talked about what can help, either medication or supplementation. So then comes the important part, which is insulin resistance. So that can be tackled in two ways: diet and lifestyle changes, right? Like physical activity. So through diet, we talked about potentially low carb diet, or even moderate, or you can go up to 65%, but you need to make sure you get enough protein and enough fat. So what happens is, in an Indian, especially Indian vegetarian diet, the protein consumption is very low. In fact, carbohydrate can be even 75% or even more than that. So I'm not saying it's not possible for vegetarians to get enough protein. You need to consciously make that effort to get enough protein. Now, that's the dietary approach that works for insulin resistance. Now, let's talk about the physical activity approach. Now, physical activity is not my area of expertise, so I don't tell people, what exercise they should be doing, but I give them the general guidelines, and I emphasize from a physiology perspective why physical activity is important. So the World Health Organization recommends that you need to get 150 to 300 minutes of physical activity every week. And this can be through, jogging, walking, or running, or whatever you want to do. Just get some physical activity done. Now, I suggest that my clients follow a strength training protocol too. Now, it's very important, because when you're only doing cardio, you tend to lose some muscle also. To prevent that muscle loss, you need to do strength training to retain your muscles. Now, this is a very important factor when it comes to insulin resistance, because, so what is insulin resistance? When you have it, your insulin is produced, but your cells are not sensitive to it. So insulin is basically like a key that unlocks all your cells. And when you eat your meals and glucose is absorbed into your bloodstream, it's kind of locked into the cells with the help of insulin. So when you have insulin resistance, your body's cells don't really react to insulin. They're not opening up the cells to absorb the glucose that's in the bloodstream. That's why you have elevated blood sugar levels, and which is why when it goes to full-blown diabetes, you have insanely high blood sugar levels, right? So now muscle is a very big part of your body composition, right? So when your muscles are insensitive to insulin, that's when your blood glucose can spike up. So you can improve your muscle sensitivity to glucose by doing strength training, right? And then it prompts your muscles to open up the cells and absorb the glucose intake, so glucose goes down. Now, the other benefit of strength training is, like if your muscles are not absorbing glucose, basically energy, they tend to lack energy, which is why when you have insulin resistance and when you're not physically active, you feel tired, you feel lethargic. So, which is why you need to open up your muscle cells to bring in the glucose so you can fuel your workouts better. So, which is why when you're feeling lethargic or tired, it's important to exercise so you feel energetic, right? So, strength training prevents muscle loss. They can promote, insulin sensitivity. They can make your cells more sensitive to insulin. And also, in general, I feel like cardio plus strength training is a great, combination. Now, that being said, I don't really force everybody to, go to the gym and start lifting weights, because it's also important to understand that, different kinds of women come to us. Now, a lot of people have access to the gyms, but there are also women who are married who don't have the time to, go to the gym, work out and come back. So it's not like a blanket recommendation like you should go to the gym and do strength training. No, I gently, suggest and push my clients to do some form of strength training. It can even be body weight exercises. You can do it at home. You can use your body as the weights. You don't need external dumbbells or barbells or something. You can use your body weight and incorporate strength training. So that's how you tackle insulin resistance.
Yes, the minimal the workout from the home could be also the major beneficial for them. And yes, speaking of, we were talking about vegetarians, they might lack proteins in their diet as such. And there's also another view, whenever patients go up to the nutritionist, they always like write the salad as their diet, part of the diet, and also most of the salad have broccoli in it. And in India, the broccoli is not like locally available food. And yes, and I guess the diet plan should have more locally available fruit from India. So I guess you can give me some, some options for locally available food which can be, good for maintaining protein or carbohydrates or fats in the diet.
Yeah. Yeah. So the first recommendation, that researchers or like even doctors or nutritionists make when it comes to PCOS is to lose that extra weight. Now, there are three
Mm-hmm.
types of PCOS, like three types of patients who can have PCOS. Now, ones who are overweight or obese, but there are also people who are lean and can have PCOS, who are normal weight and they can have PCOS. So when people are overweight, the first recommendation is to lose that weight. And for all three groups, the other recommendation is to eat healthy. And then the third recommendation is to do physical activity. So when it comes to
Mm-hmm.
overweight and obese people who have PCOS, I genuinely believe that these nutritionists have good intentions to make them lose that extra weight. But the way they go about it is wrong. Like, for example,
Mm-hmm.
I was at a hospital in Trichy, and the
Okay.
dietitian there was handing out meal plans to people who wanted to lose weight. And I just saw that. I
Okay.
was so shocked because the calories were like at least like only 600 or 700 calories. And like you said,
Oh,
soups for lunch or just, lettuce
oh
and
my God.
broccoli salad for lunch. I'm like, you're distributing this in Trichy. Like, how do you expect people to follow it? And it's so restrictive. And how do you expect them to
Mm-hmm.
survive on this diet for more than a day
Yeah,
or two? Right. So especially
that's got to
people
be
who
heard.
have low blood pressure, if they follow restrictive diets, right, or just
Mm-hmm.
fruits or just vegetables and not enough
Mm-hmm.
protein or fats, they tend to get dizzy. Their blood pressure lowers even more. So it's very important that we don't put clients on like those crash
Mm-hmm.
diets. So we need to make sure that they're doing like what is working for them. And that brings us to our next point. Now, what works for you is what you're already eating or what is
Mm-hmm.
available when you go to the nearest store or market. What fruits and vegetables do you see? That's what is important. So, I mean, broccoli, I guess the concept is to make you eat more green vegetables,
Yeah,
and it can be any green vegetables that are available, right? Spinach, like you get so many
yeah,
varieties of
exactly.
spinach, and it's local, it's so cheap, so you can instead have spinach instead of having broccoli. And any gourd
Yeah.
vegetables like snake gourd, bitter
Mm-hmm.
gourd, so those are good.
Yeah,
Those are also green vegetables at the end of the day. So you can have all
yeah,
these local varieties, and it doesn't necessarily have to be green. It can be any vegetables for that matter.
yeah.
And when it comes to
That's.
fruit, you don't need to, have fancy fruits like berries or something. If
Mm-hmm.
you live in a place where you get berries, then go ahead. But you can have just, regular fruits like oranges,
Mm-hmm.
apples, bananas.
Yeah.
All of them are fruits as well. So my recommendation is when you go to the store where you buy your fruits and vegetables, what do you see? You buy that. And also
Mm-hmm.
grains, you don't need to eat fancy grains like quinoa or something. You can just have millets. And this is the other thing. I don't even tell people to incorporate millets if they don't like it. You can have white
Okay.
rice and still tackle your PCOS. Like I
Yeah.
said, it's not about one food. What do you eat with that white rice? That is what is
Mm.
more
Yes.
important. Do you get enough protein, fiber, and fats in that meal, or are you only eating carbohydrates? So,
Mm-hmm.
people eat a lot of rice. They add like a little bit of sambar to it and think, okay, I had enough protein in this meal.
Mm-hmm.
No, no, it really doesn't work like that. You
Yeah.
need to cut down the rice to match your requirement, and you need to
Mm.
increase
Yeah,
your
exactly.
protein content in that meal. So honestly, I think that is how you need to plate your meals, and your food selection can be what works for you, what is
Mm.
affordable, and what you can get in a fresh food
Exactly.
market or wherever you go.
Yeah, that's actually a very good one because whenever the diet comes up to every person, they first think is one is it's a calorie deficit, and the next one is it's very fancy. So these are the two topics that comes up. So and as such, it couldn't be so fancy. You can get to the market, you can see the vegetables and fruits available, and I agree on you. The gods are so underestimated vegetables here. So, and I think you should go for that instead of trying, first of all, in the fancy foods like broccoli and such. And yes, greens are much available here, and you can opt for that too. And that's very nice point. And apart from that, so so I think we covered most of the topics that we plan to cover. And any other points that you like to add on? Like if you want to say something to the women who want to, combat or manage the PCOS, so what would be the
Mhm.
basic, opinion or suggestion from
Mhm.
you?
So the first thing is the doctor needs to make the diagnosis, and when they
Mm-hmm.
diagnose you, they do what they know best. Like they know how to treat your symptoms. Now, if
Mm.
you want to treat your symptoms, like I said, why it's important to tackle absence of periods immediately. So doctors feel that sense of urgency, and they give you the medication to tackle that. And also, if your blood sugar levels are high, they give you medication for that. And I'm suggesting strongly that women get their PCOS screening done so they know well ahead of time if they need to work on their
Mm-hmm.
fertility and other issues. So that is the first thing I emphasize. Get your health checkup done. Get everything diagnosed early on whatever condition it is so you can tackle it. Right? And when doctors prescribe medications, I don't usually go
Mm-hmm.
against it and say, you know what, you don't need it. No. I give my clients
Mm-hmm.
the option. See, you can do this, or you can treat whatever the root cause is, you can treat that. Now, we don't know exactly what the root
Mm-hmm.
cause is, but we know that
Yeah.
unhealthy diet can be a root cause, physical inactivity
Mm-hmm.
can be a root cause. So, we can treat these with lifestyle management. So, I give them the option. Either do it side by side or give us a shot to help you manage your lifestyle better, and then you can choose to go for medication. So I think these are the two approaches that clients can
Mm-hmm.
take, and they need to take something, take some action,
Yeah.
right? They can't not go to a doctor and get the medication, right
Mm-hmm.
medication, or
Yeah.
they can't
True.
not go to a nutritionist. So go to either of these people or both of these people.
Mm-hmm.
That's what I strongly recommend. Get it diagnosed and get the right treatment for it. And if you're focusing on lifestyle changes, I definitely suggest that people work with a nutritionist and a trainer, because firstly, people can eat healthy food and still put on weight.
Mm,
Eating
yeah.
healthy doesn't necessarily translate to maintaining your weight, losing your weight, or
Mm-hmm.
gaining weight. No, it's about the right proportions and the quantity that you need for your body, and you can't determine that by yourself. If you have enough nutrition knowledge, go ahead, and if you're informed enough to do that, you go ahead. But if you don't know what you're doing, it's better to seek out a
Mm-hmm.
professional who can give you the right guidance instead of wasting so many months and years trying to
Yeah.
nail your diet. No, it's going to be so
That's
much easier when people come to me. It just takes 2 months for them to see the changes. So instead of going the roundabout way trying to do things on your own, it's easy to just directly approach a nutritionist and work with them. And with a trainer, sometimes you could not even know what to do when you go to the gym
yeah.
or even at home. I know there are YouTube videos, you can pull up YouTube videos or something in random and do it, but you might not see progress, which is why I definitely
Mm-hmm.
recommend working with professionals who can help people.
Yeah.
Yeah. And
Yeah. That's it.
yeah, I guess that's pretty much it.
Yeah. Yeah, that's good. Instead of, adding up on the medication, and also we know the definite two causes like lifestyle changes. I'm sorry for my voice.
It's okay.
Pardon me. Yeah, so we know the actual reason causes behind it, like lifestyle changes and the, diet. And thank you so much. Let me drink some water.
Okay.
Thank you. I'm
Mhm.
sorry for that. So yeah, again, so as we are talking, we know the actual two reasons behind like a diet can be the cause or physical inactivity may be the cause.
Mhm.
So we can start addressing these both first, and also you can take up the medications if that's your doctor telling you. So
Mhm.
I'm struggling here. Sorry for that.
No
So yeah,
issues.
so guys, if you have any questions, and you can ask that to our nutritionist. I guess there's no questions.
I see that
And
Alice said something really nice.
yeah, your questions are great and the very informative points you put up on. Yeah. Actually, yes, I should give you, you very structurally put on the points that you have to go this step by step process as such. And people are so worried about their symptoms alone, and they
Mm-hmm.
want to combat in a very particular way. And obviously the selection of foods and the supplements can help, and there's a lot of other information, and you provide the basic knowledge as well, what is ovary and how it is causing as such, and there is no proper causing, and you should nullify and cut down the other causes for the PCOS as
Mm-hmm.
such. So yeah, that's very informative and to the point
Mm-hmm.
answers to every question. So thank you, Badi, for having spending this time to
Mm-hmm.
let people know what you have to do and what not to do. And I think there's another question. How about sleep pattern? Do you think it is added factor affecting to the condition?
Mhm. So there's something called chrononutrition, which is the timings in which you eat. So people who tend to eat earlier in the day, like early breakfast, early lunch, early dinner, tend to have better health in the long term compared to people who have a late breakfast, late lunch, late dinner. Right? So they are called the evening
Mm-hmm.
chronotypes. And the ones who wake up early, do everything on time, go to bed on time are the morning chronotypes. And they tend to have better health in the long run. Better health as in better, blood sugar level, better blood pressure control. So yeah, overall, in general, people who do things earlier during the day
Mm-hmm.
have, better health.
Yeah.
And regarding sleep pattern, yes, it's definitely important to track your sleep, see how often you wake up and things like that. It's good information to have.
Mm-hmm. Yeah, actually, that's a very big questions too because people have a lot of shifts now, like night shift, morning shift, and they keep tend to change. And even the younger adults now, having this kind of trend, insomnia, and they
Yeah.
are talking it as, that's usual. And also, yeah, I think we should address, and that's not a healthy pattern. You should try more better healthy pattern, sleep
Yeah,
pattern.
yeah.
So yes, and thanks for the question. And is
Mhm.
there any other question? And I guess that's it. Yeah. So thank you, Badi. It's very nice talking to you after so long time, and thank you for everything with CysterCare.
Yeah,
Yes.
yeah. Thank you
Yeah.
for hosting me.
Yeah.
All
Sure.
right. Yeah.
Thank you. Have a
Bye.
nice day.
You too. Bye.
Bye. Yeah. Come back to Chennai soon.
Yes, I will.
Yeah.
All
Sure.
right. See
Bye.
you guys. Bye.